the stones. Placing our warm stones gently, tracing the crown chakra area, and beginning with our normal facial manipulations. Now please remember the length of this treatment is a 90-minute treatment. So I suggest that you incorporate your facial manipulations the same length of time as you normally use in your 60-minute Swedish treatment. Also incorporating the same type of manipulations. What you see demonstrated here today are suggestions. I highly encourage you not to change how you work as a therapist, because each of you has their own unique style and will vary also per client. I suggest using a nice medium pressure. You may also incorporate the stones into your scalp manipulations. After you've completed your facial and scalp area, then you will gently leave the body and dispose of your stones in a container which you will later use to take to your sink area. Now, having retrieved 2 medium stones from our heating unit, the first thing we would do is emulsify our lubricant in our hands and rotate the stones. And the primary reason for this is to cool the stones, because we certainly would never apply the stones directly to a client prior to first having cooled them. We would do this several times, and we would transfer the lubricant onto the skin. Again, this gives us the opportunity to assess the tissue and also to allow the stone to cool properly. I suggest we do this several times. Also, please note that in your occipital area, you could also incorporate one of these contour stones in the wrapping procedure. And this will allow your towel area to stay nice and warm. And it's a nice little add-on procedure. Now, as we're ready to begin, gently introduce the stone and begin with your normal massage procedure. Again, I highly recommend you do not change how you work as a therapist, incorporating the same type of movements, allowing the stones to become an extension of your hand. The duration again will vary according to your working style and what you're trying to accomplish. You will note that each movement is nice and fluid and slow. This is crucial in the incorporation of the stone massage and chakra therapy, because we are working primarily on energy transformation. After you've completed this entire area, you will then bring your stones around and just rest them gently. Now, we're going to retrieve 1 medium palm stone for each hand and arm. we're going to retrieve the stone that's beneath James's hand. That is actually the one that we're going to begin our manipulations with, because that one has had enough time to cool appropriately. We're going to relubricate both stones. Beginning with the one I just retrieved, which is the warmest stone, we're going to squeeze and transfer, because we would like the stone to begin cooling appropriately. And we will begin our actual hands-on manipulation with the stone that was beneath James's hand. And you slowly begin incorporating. Again, allowing the stone to become an extension of your hand. And when you feel the second stone is cooled appropriately, you can now begin incorporating it also. I suggest medium friction. And again, the duration of the actual hands-on time will vary per client, will vary per therapist. Incorporate it in the same manner as you would your normal 60-minute Swedish. This is a 90-minute treatment precisely due to the fact that you will be placing and removing the stones. Once you've completed this procedure, you will now use the second stone, which is still the warmest, and leave that in your client's hand. Okay, now we're going to do exactly the same procedure on the second arm by again lubricating our stone and transferring our product after having retrieved our second stone. And applying our lubricant. And beginning with the stone that was beneath James's hand, beginning our manipulations. Testing our second stone, which is our warmer stone, transferring, and gently begin incorporating it. Suggest normally using nice medium friction, allowing the stones to become an extension of your hand. And once you've completed the entire arm, again allow the second stone, which is still the warmest, to then rest in the client's hand. Now we're going to begin with the lower extremities. The first thing we will do is undrape our foot and retrieve our contour stone. And gently begin by removing our toe stones after giving it just a slight pressure and removal. And now we will begin by lubricating the leg. Lubricating our stones appropriately. This in turn allows them to cool and to glide easily. Again, squeezing and transferring the warmth onto the body. And once we feel that the stones are at the appropriate temperature, we can begin incorporating them. Always beginning very gently, and then we can add pressure. We can use the stone flat or on its edge. Again, this will vary per client. The key is never to use stones that are too warm, and also to avoid our bony prominences. Now we can incorporate our second stone and begin our normal massage procedure. Again, the duration of these manipulations will vary according to the therapist. I suggest same time frame as you would normally apply in your 60-minute Swedish treatment. And once you've completed the entire leg, gently feather off and place your used stones in a bin where you will later wash them prior to returning them to your heating unit. Now we begin on our second leg, and after undraping the foot and removing the contour stone, we will gently begin again by pressing and removing the toe stones. Placing them again in our used stone bin. We will now lubricate the leg. Retrieve 2 more stones. I'm going to use 2 varied sizes here to give you an indication of how to use the varied sizes per client. Larger stone we would use on a larger musculature mass. And again, this will vary according to client. So again, always having made certain that the stones have been cooled appropriately, we gently introduce the stone and we begin with our normal massage procedure. Again, noting to avoid our bony prominences, you can use the stone on edge, flat, depending on your treatment style. Now, noting that we come in very gently, also avoiding our endangerment sites, such as our popliteal area behind the knee. And gently leaving the body. Placing our stones again in our used stone bin and redraping our client. Now, prior to turning our client and the removal of our stones, in this stone chakra resonance treatment, I suggest that we begin again by gentle tapping procedure. And now we will begin the removal of our stones prior to turning James. Now we gently fold our towel together and remove our stones. Now we will be preparing our face rest and our table in preparation for turning our client. Now we're going to ask our client to turn and place his face in the face cradle, assisting with the other hand, draping them. We're going to undrape the back and lubricate. And now we're going to retrieve 2 stones. One to be placed on the sacrum and one optionally for under the client in the area of the solar plexus. This stone, highly suggest, should always be covered with a towel prior to placement. Second stone, introduce very gently to the sacrum. Cover and secure. This way you can be sure the stone is not going to be moving as you're massaging. Next, you're going to retrieve again 2 stones for your back placement. And manipulations. Again, always remembering to lubricate your stone adequately, transferring and gently introducing the stones and begin your normal massage manipulations. Again, avoiding your bony prominences. Size of the stones will again vary per client. You can also use the stones at an angle. And again, gently leave the body. Redraping the back. Gently incorporating the warm stone into the gluteal area. Non-invasively massage. And leave your stone.